Let us examine two terms which are in everyday use, very commonly used: heart attack and cardiac arrest. Let us first take heart attack. Technically, we use this term to denote a condition where blood flow to the heart muscle through a coronary artery is totally occluded, completely stopped, and the part of heart muscle that is supplied by the coronary artery gets damaged and even dies. So this is what you mean by heart attack. The patient usually comes to us with chest pain. This pain may be generally felt in the central chest region, but it can be in other locations also. For example, it can be shoulders, it can be upper abdomen or hands, sometimes even the back. Now there are several other conditions which can give rise to similar pains. So the diagnosis of heart attack basically depends on the electrocardiogram. The changes in electrocardiogram appear immediately after the coronary occlusion. So we can reliably use ECG or electrocardiogram to diagnose heart attack. Our further management depends on what we find on the electrocardiogram. We can also locate which part of the heart is affected from the changes in the ECG. The immediate treatment in these patients obviously should be to open up the artery that is blocked. At KIMS, our policy is to do an emergency angiogram and do an angioplasty, which is called a primary angioplasty, to unblock these blocked coronary arteries. By any reason, if it is not possible, we give a medication to lyse a blood clot that has formed in the coronary artery and establish blood flow. But primary angioplasty is certainly superior to the technique of thrombolysis. That is how we manage heart attack. Now let us look at what cardiac arrest means. This is a different term. Cardiac arrest means a condition where the effective contraction of the heart is stopped, does not happen anymore. It can be there are two ways in which this can happen. One, there may not be any electrical activity in the cardiac ventricle, cardiac pumping chamber, or the pumping chamber may just vibrate or fibrillate and not pump effectively. The first one is called cardiac asystole, and the next one is called ventricular fibrillation. Both result in cardiac arrest. When this happens, there is no blood flow, no pumping action of the heart, no blood flow into the brain or other organs of the body. Immediate result is something we can imagine. Patient loses consciousness and stops breathing, and if it is prolonged more than 3 minutes, it can result in a fatality, it can result in death. So this is something that requires immediate treatment. It is not like heart attack. It is a primary thing here is to re-establish cardiac action. If it is a ventricular fibrillation, the primary thing to do is to defibrillate. There is an equipment called defibrillator which corrects the cardiac rhythm and the heart starts its action again. If it is asystole, we have to keep massaging the heart for some time and then implant a pacemaker using a pacemaker device and a pacing wire that goes into the ventricle. We can pace the heart. In any case, the immediate treatment for cardiac arrest is to re-establish cardiac activity. Cardiopulmonary resuscitation indicates restoration of heart function and lung function when cardiac arrest occurs. This is immediately instituted when cardiac arrest occurs. And every doctor is trained in CPR, in cardiopulmonary resuscitation. Now, it is now mandatory to have proper training in cardiopulmonary resuscitation and advanced cardiac life support to treat cardiac arrest when it occurs.